Welcome, everyone, to another episode of You've Got the Power. I'm your host, Dr. Jason Deitch, and of course, we are here with Chief Wellness Officer, Chief Medical Officer of the Centeno-Schultz Clinic in Broomfield, Colorado, Dr. Chris Centeno. Good afternoon to you.
Good afternoon, Jason.
Everyone, we have a very special episode. Dr. Centeno mentioned last week that we're going to start bringing guests, real people, real experiences, real circumstances and situations onto our program. You may be one in the future. We're having our conversation about the PICL procedure. Dr. Centeno, let me kick it over to you and explain, who is our guest and why is she joining us today?
Thanks, Jason. Well, first off, I think we had advertised, we got our lines crossed and we had advertised a different topic on Facebook this morning. So if you're seeing this and you saw that, you're like, wow, this is different than I thought it was going to be. But I think this is going to be far, far more interesting for patients that have craniocervical instability. And that is actually interviewing one of our first PICL patients, Pam. And what I'd like to do is basically I'll give a quick overview. I mean, we were treating Pam for years, and then we developed this procedure. We kind of knew she had craniocervical instability, but we had no way to treat it. So she was one of the first patients we did this procedure on. She's had numerous procedures with PICL, so she's learned a lot. And she's also made tremendous gains. So I thought this was a great opportunity to bring Pam on and allow either existing PICL patients or prospective patients to ask questions of either myself or Pam about her experience and try to get some pointers from her since she's been through the whole process now. So that's pretty much it. Let me turn it over to Pam, and Pam can give us a brief summary of where she started in this whole process, kind of where she went along the way, and then where she ended up.
Pam, you're up.
All right. First, I want to thank you for having me. It's made me go back and think about my journey because it's been years, like you said, Doc. It's been years. And before I was fortunate enough to find the Centeno-Schultz group, I was under the care of a neurologist and a classic pain management. I was getting cortisone pumped into my joints every 3 months, just attempting to have some kind of semblance of life. And it kept the pain at a tolerable level, but the pain was constantly there. I was told by multiple medical providers that it isn't a matter of healing. It is about pain management and learning to live with it and trying to make a life with it. And so that's what I went about doing. That was the standard approach to this at that point. They said I had nerve damage. There was no way it was ever going to get better. So as I was going along, getting every kind of treatment you can think of, Botox shots in the head, cortisone in massive amounts of joint, every year I'm getting weaker and weaker, losing more and more functionality until one day I got in a very minor car accident. Very minor. I'm not even sure the two bumpers got scratched. And I had an instant pop in my neck, numbness down the left arm, and was rushed to the emergency room. And I was in agony for about 3 months. Every single thing that I had done before to control the pain, which were the cortisone shots and the insert all of the medications and everything like that, quit working. That's how weak my neck had gotten. I was fortunate enough through my functional medicine doctor to hear of Centeno-Schultz. And I went up there and they started with, let's see if you're even a candidate for this kind of procedure whatsoever. And so I had Prolo and PRP, noticed some improvement in just the shoulders and the ability to maybe even relax my body. the excruciating pain became tolerable again. At this point, I was told that they were working on this procedure that I may be a candidate for. And I did a number of other procedures well before that and had great results. So by the time I was ready for my first one, it wasn't even called PICL at that time. I think there was not even a fancy name, right? We were just doing it. I was ready. And at that point, I had learned a lot about how to prepare my body to heal, not to learn how to live in pain, how to prepare to heal. I was so excited. So our first procedure, I got an improvement that excited me so much. I went full on, I'm ready to heal. What do I need to move out? Any roadblocks that can help the work that these fabulous people are doing actually be the best effectiveness for me? And how can I imagine living a life again without pain? I have had 4 procedures. I really was hoping I would only need 3, but that 4th one was definitely needed. And thank goodness I decided not to stop before I was done, because that 4th one was the cherry on top. I can actually look down and read a book again. That was what the 4th one gave me, is the ability to look down. We do everything in life looking down. And now I'm working part-time. I've been unemployed and on medical leave since 2005. I'm actually working part-time. I get to dance with my husband. I do so many things now that I had lost. That's what preparing for this meeting today and live today allowed me to do. I get to look back and remember how horrible my life was and see how amazing it is now. I literally could not look down and read a book. I had bought these silly glasses that had a mirror that comes down so that I could hold the book on my lap and I could read through the mirrors, because just having my head like this for more than 5 minutes caused me agony. So there's been a lot of improvement. My life is amazing. At this point, I couldn't be happier.
Well, thanks, Pam. And that's really what prompted this Facebook Live interview with Pam, is that, I had seen her back in the clinic this last week, and I didn't even talk about her neck. She was there
for the
for
first
something
time
on her back. And I think both of us realized it was the first time we really hadn't talked about her neck, and that hadn't been the focus of the visit. And then she had added, hey, oh, by the way, let me tell you what's going on with my neck. So it was kind of a funny juxtaposition that caused this. Well, let's open this up to if there are any questions for Pam or myself, because I think this is an opportunity to really ask someone who's been there, done that. And Pam's done some other interesting things in her journey that I think most PICL patients don't do. So at some point we'll get to those, or someone can ask her about those. I don't know if we've got any questions, Jason.
We do. If you've got questions specifically for Pam or specifically for Dr. Centeno, put them down below. I'll get it started and then I'll read some of the others. Pam, I love the distinction you make. I try to make it on regular shows each week. And that is the distinction between, as you've said over and over again, healing your body versus just the pain management. I think that's one of the most important sort of aha moments, and the distinction between getting a cortisone shot that may temporarily relieve your pain with a big expense later, and I don't mean financial, and the new understanding you have about what healing really is. How would you elaborate for people that may not yet understand that aha moment? How would you explain it to them?
I would explain that my intent was always to heal. And I was told by multiple doctors, and I tell you, I saw a lot of doctors, physiatrists, neurologists, orthopedic specialists. Every single one of them counseled me strongly about not setting my expectations to heal. That seemed amazing to me, first of all, and took me years to even come close to believing. And when I finally found these guys, I have probably had been to at least 8 different specialists trying to figure out. Somebody wanted to talk about a high neck fusion. Somebody wanted to talk about living in a halo for the rest of my life. All these kind of things. Everyone else was trying to help me figure out how to live with this. The Centeno-Schultz group is the first people that said to me, in any way, shape, or form, we can make this better. We can help you get rid of what the problem really is and let the body heal. It isn't a magic pill, but it is the long-term game. I'll tell you, it's the long-term game. If I had continued to put cortisone after cortisone in my body at this point, the way it was deteriorating the ligaments, and I probably wouldn't even be able to sit upright at this point. This is the way to get your life back. This is the way I got my life back. That's how my life got back. It is the only regenerative approach I was ever told about.
Thank you for sharing that. Thank you very much. Okay, let's take some questions from, we've got a lot of viewers today. Pam, you are popular, so thank you for joining us. Let's see here. We've got Adrienne Couvillon Barnhill, a regular viewer. Hello, Adrienne. She asks the question, I have multi-level bidirectional rotation in my C-spine in neutral position, some significant. The PICL path will treat a rotated C2 and accompanying posterior PRP treats the other levels. But should I be getting additional posterior injections between PICLs to reduce the rotational stress on C2 from below to improve the PICL outcome? Could cervical PRP in the mouth following a PICL interfere with the healing process?
Yeah, I think we should all keep it within the same vein. So what I mean by that is that realize that for PICL, we would be focusing on things that can impact both C0, C1, and C1, C2. And so if you need additional injections posteriorly between PICLs, we can certainly have that conversation. That's not normally how we do it, but it's possible to do that. But I'd have to know more about your specific situation and have a one-on-one conversation about that. But realize PICL would be both 0-1 and 1-2. This may be a good time for Pam. Pam, talk about the type of rehabilitation you did, which was very different than most patients pursue, and I think was also a big part of your recovery. Why don't you tell everyone about what you did there, because that kind of addresses this multidirectional instability issue more from a muscular standpoint.
Well, I did a lot of things. So the one thing that my neurologist helped me with, honestly, was when I went to him, he said, well, since there's no way to heal this, what you should learn to do is minimize the effect of this on the rest of your body. So once I realized I could heal this, I took that approach still. What can I do to maximize my healing all the way through? And that is what I focused on. My job in this role, because this isn't Dr. Centeno healing me. This is a collaborative effort, okay? So I'm going to take what he can provide me and I'm going to maximize it to the best I can. So I went in and I found from a functional medicine doctor, what can I do to ease the amount of stress in my overall body and all my organs and everything that living in chronic pain does? Worked on that. I went and did a bunch of biofeedback, learned how to control my muscles and feel where things really are hurting. Because when you're in that much pain, it radiates everywhere, right? And so it's hard to say this shoulder hurts, that shoulder hurts. I worked with physical therapists to find out where I had atrophy, where did I have muscle dysfunction, where did I have all of those other fancy words, hypertrophy and all those things, right? and started working on not only my neck and shoulders, but an overall body approach to making sure that I'm not compensating. I also did food. I got rid of all inflammatory food in my diet. The list, I'm trying to think of all of them. Those are just the ones
And
off
how
the top of my
about
head.
talk a little bit about the gyrostim, because that was a super unique one.
That one was massive. So here I have been going through physical therapy and rehab and all this stuff for years. And we just kept hitting a wall. And I had had a history of concussions as well. So we started looking at how can we change how the nervous system is gotten used to responding to pain. And so I my physical therapist is spectacular. He found this other gentleman who had some new um, technology out there called gyrostim, and it's basically you're sitting in this crazy machine. It looks like one of the machines that astronauts train for, for out in space. It has you go like this, but it is working on your vestibular system as well as all of the little teeny intrinsic muscles throughout your body. And it moves you in a way that you cannot duplicate in regular exercise in any way. And the gentleness of it and the change and strangeness of it started pushing my neck back to where it could function again as a whole, as opposed to getting these muscles strong and these ones were still turned off. It helped do that overall balancing that had been missing for a couple decades actually in my neck with all these injuries. It's a little crazy. It looks weird. It looks scary, especially for anybody who's had neck instability. You want me to sit in that? But reality is that is how I started it after my third procedure and then was going to do it immediately after my fourth procedure as well, but only recently finished it up after my fourth procedure. And it was the final phase that I needed to be able to strengthen my neck and get it back to normal. I've done some crazy therapies. This one was spectacular.
Thank you, PM. So Jason, more questions?
We do. We've got Damien Gold making the comment. Hey, Damien, thanks for joining us. He goes, thank God it's Monday, TGIM. Pam, thank you so much for your testimony and time, one of our great regular viewers. Betsy Batts follows up by asking, how many years of CCI have you had?
I started with breaking some bones and tearing muscles in my lower back in 2001. And while I was healing from that, a couple months later, I got in a car accident. And that started the whole neck problem. And so I've had problems at the top and the bottom of my spine. And everything in between was just holding on for dear life. So by the time I was in enough pain and it got fully diagnosed and all that kind of stuff was 2005, but in reality, it was since the accident in 2002.
Thank you for letting us know. Let's keep going with questions. This was submitted in advance by Sherry Tomaso, who asks, I've been on doctor-prescribed pain medications for a year due to a neck injury. Based on what I've read on your website, I think I may have CCI. Would I need off my pain meds to be treated? Doc? Do they need to be off?
Does she have to get off pain meds to be treated? Yeah. So I think right now the answer is it depends. So if, for instance, you're on high-dose narcotics, then that could be a real problem, both in getting you to sleep safely for the PICL procedure and in trying to manage pain post-PICL procedure. So if someone's on high-dose narcotics, then we generally try to get them off of those drugs. Now, sometimes if it's not possible, then we will realize that that's going to be a substantial limitation and try to get them better and then wean them off. So it really depends on what you're on and what the doses are and what the practicality is of getting you off. But realize that being on high-dose narcotics is not an elegant solution for managing pain long-term. It's a really bad solution for managing pain long term because it rewires your central nervous system to make it more reactive to pain. So getting on these drugs and staying on these drugs actually makes you worse, not better. So that's sort of the problem that we've learned over this last 5 to 10 years. So it will really depend on a personalized look at what you're on, and then go from there.
Appreciate the question. Thank you, Sherry. New question from Dashbag Florine, who asks, I have alar ligament torn left, one craniocervical instability. It's debilitating. My question, is someone doing your procedure in Belgium? I'm from Italy.
No, no one. We've trained nobody in this procedure, so there's no one that is permitted to do the PICL procedure outside of Colorado, and that's because there's a lot of different things that have to happen. Number one is you have to be trained in this procedure by us, and there's no one in Europe that has been trained in this procedure by us. So that doesn't mean there might not be someone trying to fake and bake it. But I don't think you want to fake and bake of this procedure. The other big issue with this procedure is because infection risk is such a big problem in this area, meaning an infection in this area could potentially cause meningitis. Thankfully, we've had no infections. We do a lot to prevent infections. And one of those things we do is that we have a CGMP class clean room where the cells are processed. And there is no other facility on our network or in Europe that would have a GMP class clean room to do this kind of processing. So because of those things, we don't allow any use of this procedure outside of Colorado at this time. Now that may change, and at some point as I get older and decide to move on in my life and do other things, we will have other people that get trained, but those people are going to be few and far between and are going to have to require a lot of hand-holding to do this accurately and safely.
Just to confirm, you are doing telehealth conferences, so even from Belgium, or excuse me, I'm from Italy, either Belgium or Italy, they could get on a telehealth conference with you, learn more about their particular situation, and basically see if it's worth coming to the States for this unique procedure. Is that accurate?
Correct, yes. We offer telehealth conferences all over the world. We see patients from all over the world. And that's usually not an issue because really we're talking about coming to the States here for this procedure once every 4 months, the soonest. So the way we have formatted this, it's usually not an issue on the travel side.
Right on. Thank you, Dashbag. I hope that answers your question. Moving on to Maria Malisova. She asks, hey, Pam, was pain your only symptom or did you have others too?
That's an interesting question. I'm not sure you can have just pain as a symptom. There has to be something else going on. I had extreme loss of function. Even just sitting here today and prep for this stuff, for this meeting, I couldn't wear earbuds in my ears without causing massive pain. The amount of loss of functionality was amazing. I couldn't cough without really causing myself a lot of pain. So the other symptoms that I had was complete and utter loss of strength, flexibility. I had too much. I would go to new doctors and they go, well, your range of motion is great. Well, yeah, the problem is I had too much range of motion. I could practically turn my head all the way around, so there were a lot of other symptoms. I had one of the biggest things that really this affected for me was sleep. I could not lay down comfortably. Sleep was not my friend. I would lay down and I would wake up in twice as much pain or 3 times as much pain and be in agony for hours until I could get my body to calm down, until I started wearing a big neck brace at night. Then that caused my own problems, So I don't know how to answer that question because absolutely there were a lot more symptoms than just pain. Absolutely.
And how about dizziness and balance, other neurologic symptoms that you had, any of that?
I had a lot. I actually had a lot of numbness in my hands. I played the piano. I couldn't play the piano because I had such numbness and lack of function in my hands. I had dizziness. If I turned my head too quick or even coughed, I would get very, very dizzy. My balance actually was pretty good, but mostly because my balance came from my eyes. Anything I tried to do with my eyes closed, I was totally off balance. So
Like,
there
how
was
about getting up in the middle of the night to go to the bathroom, that kind of thing, if it was dark?
oh, absolutely. My poor husband I had to turn on all the lights. I always had to use my eyes for my balance. I had to always turn on lights, and to be able to just get a drink of water. Actually, I rarely would drink water in the middle of the night because it did require me to sit up fully, and make sure that I was drinking properly because I could choke on water pretty easily at that time because I didn't have a lot of function in my neck for swallowing. So I had to sit upright and I had to make sure that I was centered over my body to drink. So there were a lot of things that I couldn't do that way. Um, any other suggestions on what else? But
No, I think that's good. Let's
yeah.
continue with questions.
Yeah, Adrian follows up with a question. Pam, what was your time interval in between PICLs, and what did you feel was the best timing for you?
The first one, between the first two, I think was about 9 months. And that was probably too short, but only too short in the way that I was not prepared completely. I was in the middle of getting rid of the inflammatory food and changing diet and stuff like that. If I had give myself maybe 3 more months to really have cleaned up my diet, it probably would have been more effective. But it was about 9 months between one and two, a year between 2 and 3, and a year between 3 and 4. And that's because a year for me was the perfect amount. At 6 months, I really felt the effect of what the healing was doing. And then it gave me another 3 to 6 months to try and strengthen and retrain the body to the new level to see if that was all I needed or not. And then anything that lingered at that point needed to be looked at again. So I would say 9 months to a year would be a good length in between them. That's what I would do.
Thank you very much. This one from Betsy Batts. She says, for Pam, how long have you had CCI until recovery?
I would say I just recently have fully recovered my ability to dance. In January was the first time I got to dance with my husband a year ago. And even from then, I wasn't quite recovered. I did the gyro stem, and that to me has been the topping. So from the time I was injured, where it became really obvious that all the cortisone shots had just destroyed all my connective tissues, to today is probably been 14 years.
And what a journey it's been. And you've clearly learned a tremendous amount about your body and about how this all works, which is very impressive. We got another one from Sabina Soleil. Hello, Sabina. Sabina's a regular viewer. She asks, hi, Dr. Centeno. Do you think for people who had dental appliances such as braces done incorrectly or received a blow to the head could have cranial strains and imbalanced skull bones causing CCI in the first place? She goes on to ask, for example, bad occlusion can rotate C2 through the hyoid bone. Is it worth to get checked by an osteopath and a knowledgeable dentist for that? Thank you.
Yeah, I think that, and this is a good question, that CCI and TMJ and the jaw are highly linked, meaning that when the muscles that stabilize the upper neck go offline, the front muscles and the strap muscles that link into the hyoid bone and in through the jaw take over. So then the TMJ gets involved. We've also seen it go the other way. If you've got a problem in your upper cervical spine and you have a TMJ issue, that can also put more stress on your upper cervical spine. So I think getting that addressed one way or the other, meaning we treat a lot of TMJ with CCI because they are so hand in glove. But if you've got other ways like seeing a good osteopath to get it addressed or seeing a good TMJ dentist, then that's a good thing.
Right on. Thank you for that, Sabina. Let's move on to Damien. Damien asks, Pam, are you pain-free? How many rounds of orthobiologic was injected into your neck? How was your experience with professionalism, such as punctuality and courtesy at Centeno-Schultz Clinic? Thank you so much, with a heart.
Those are all great questions. I want to start with the one that's the most important to me, of what she asked, or he, sorry. I was treated and have always been treated with the utmost respect and light with everybody over at Centeno-Schultz. I cannot say even high enough how awesome they are to work with. And they listen so clearly. To go from a doctor who has already figured out what they're going to prescribe to you before they've even met you, to go into the treatment plan and the way they approach treatment at Centeno-Schultz is night and day. They listen thoroughly, clearly, and answer every single one of my questions and concerns every time. And I feel that every treatment that I've gotten from them is my treatment. It's been specifically designed for me, not whatever special they have going on the day, or that they have a lot of extra cortisone, so they're really pushing cortisone shots this month. Nothing like that ever. These guys are always very professional. So what was the rest of the question? It was like am I pain-free?
Yep.
How many procedures, I think they were asking about. I think we said 4.
I've had 4 of the PICLs. I've had many other small, PRPs or SCP kind of things, and stuff on my low back, which is also a problem. I've had a lot of procedures, but 4 of the PICL specifically. Am I pain-free? I am 60 years old. I am not sure that pain-free is something that's real, but and I am an old athlete, and I used to I was an adrenaline junkie. I did everything: soccer, softball, hockey, ice hockey, skied, listen, everything. Okay. So am I pain-free? In my neck, I am actually. 95% of the time, I'm pain-free on my neck. Absolutely.
Pam,
Pam, I'm right there with you with the aging body. It's
yeah.
Aging is not for the young.
Yeah, I actually moved some furniture this weekend. I picked up furniture and moved it. Not a lot of furniture, but chairs and stuff. I would have never done that a year ago. But I did it on my back, went, it's been a while since you picked up anything like this. So nope, not pain-free, but I am ecstatic to be able to do something that doesn't make sense.
that is awesome. Pam, I'm going to follow up just with my own question before we get to Megan's in just a moment, which is, the Centeno-Schultz program has a program called Proactive. And I guess my question for you is, when you think about your years growing up as an athlete, knowing what you know now, what would you have done differently early in your years? And I specifically ask, sort of, many people think they have to wait until it's so bad that they just can't take it anymore, that they finally break down and come in. And other people learn sort of from that experience, wait a minute, if I would have gotten this early on, I would have avoided a lot of suffering. What's your thought on that?
Well, exactly the latter of what you just said. I was one of those 200-mile-an-hour, hair on fire, adrenaline junkie people, period. I played every sport possible. Nothing would stop me from playing. I would play with torn ligaments in my ankle. I would, I'm running around with my arm in a cast, but I'm still skiing, all this kind of stuff. I probably, in hindsight, would have stopped long enough to heal before I continued on. And I would have made sure I healed instead of, that's good enough. It's, it's not an agony anymore. I'm going to keep going. So I probably would have had a little more maturity to that, as opposed to just go at any cost, which is really what I was, especially in my 20s, yeah.
Hopefully we get wiser with age, and we realize that just because the pain is killed doesn't mean, as you've said, you're healing and you're optimally functioning and so on. We got questions that's still coming in, so thanks. Let's keep them going. Megan May asks, have you heard of RF ablation for ligament tightening?
Yeah, that seems like, I always like to use this expression. There's a Chinese expression, I think comes from Confucius, never use a cannon to kill a fly. So could you tighten ligaments with RFA? You could. Realize that radiofrequency ablation works by destroying tissue. And so, for instance, if you meet a radiofrequency ablation probe salesperson, one of the things they like to do to show you that their probe works well is to use it to cook chicken. And I know this sounds strange, but literally they'll take a chicken breast and they'll put the radiofrequency ablation probe on it and show you how they can, sear that part of the chicken breast by how hot and effective their probe is at transferring that heat. So, it's too much, meaning could you tighten ligaments that way? You could. In fact, thermal capsulorrhaphy has been used by orthopedic surgeons in the shoulder to help tighten ligaments. But it's way overkill. You don't need to do any of that to tighten ligaments. All you need to do is inject something that will cause a healing response rather than destroy the tissue. So it's possible, but it's, back to the old Confucius saying of never use a cannon to kill a fly. It's absolutely way too much, and will increase the likelihood that you're going to hurt someone rather than help somebody.
That is such an important point, and that goes back to your healing versus curing type of approach as well. Damaging tissue doesn't help the body heal better. So those are important ways to understand how this all works. Let's move on to Betsy Batt made the comment. She goes, there's 15 to 20 symptoms that go along with the pain. That was her contribution, I think probably at least. Faye Varial asks, I think a lot of people would love to talk to you in this way to understand what you do. Thank you, she says, I think for sharing your story, and that it's not just about metaphorically driving your body into the shop, having them do what they do, leave, and then come back when it's broken down or the light goes on again. That there's actually a partnership and teamwork that goes into getting your best results. Faye, thank you for your comment. Livia Benkova asks the question, do you have leg weakness or spasticity or any kind of lower back body issues?
Absolutely. Actually, my original big injury was my lower back. I had broken off the transverse processes between L2 and L5 and tore a bunch of muscles all the way through that. That was my original injury that I had prior to getting in the car accident that messed up the upper part of the spine. So yes, I absolutely do. And as it is above it, it will be below. And I'll tell you, you always have that issue. Even if I didn't have the injury, it's going to affect, it's one spine. Okay. We love to compartmentalize our body, but our body isn't a compartmentalized thing. The upper part of the neck is going to affect the middle back, and it's going to affect the lower back. So absolutely, I had a lot of issues that way as well.
Those are great points. Important to understand. It's one spine, one body, one nervous system. It's one. Dashbog follows up. He says, thank you so much for replying, Dr. Centeno. My dream is to have a chance to come to Colorado. It's just so frustrating to have to live with this for your existence and dedication for this specific problem. You are unique, even if I can't make it to see you. Thank you for your work. Thank you, Dashbog, for your contribution here as well. A regular viewer friend, Tom Walsh. Hey, Tom. He says, "Hey guys, great to hear a success story." Yes, it is. And the last thing we have for right now is Betsy Batts. She says, "Amen, Pam. They are the best. I need 2 PICLs. Can't wait to be pain-free in my neck." Pam, Dr. Centeno, let me, I guess, ask you to, well, Megan just came in real quick. I'll ask this one. Do you notice results after your first PICL? Pam,
Is that for me?
Yeah.
Yeah,
Um,
it's
yeah, I absolutely did. But, I was pretty broken. And so even an improvement of 20% was huge to me. Absolutely, that is why I jumped on board. The first procedure really was a bit of an experiment to see if my body would respond to this, and it did. And I was all in after that because I could tell if there's something that you can change to the better by doing one little thing. Imagine if you could find the answer to every single one of them. Why wouldn't you continue on? And I became dedicated at that point to try and figure out how I can help supplement all of the other procedures by doing what I could on my side. I cannot emphasize that enough. It is important to make sure that you are doing your side of the healing. His job is to do the procedure, but it's my job to heal and move everything out of my way to heal. So if it means that I have to change the way I eat, I've lost a lot more from pain than having to change how I eat. And it's a temporary thing. I can eat pizzas again. Yay, who cares? Right? But do everything you can to support it. Absolutely. It is worth it.
Pam, I got one other question for you, and then we'll wrap it up, Dr. Centeno. My question for you is, speak to those people, or what did you learn? What did you know, or how did you set your mind to recognize that continuing to do more procedures would be in your best interest? And I ask that from the standpoint that there are some of those sort of skeptics who listen and go like, well, why didn't it work the first time? And how do I know they're not pushing me to do 2, 3, and 4 for their agenda versus, for my own benefit? What did you learn or know to kind of get you to go, you know what, if I keep doing what's working, the more momentum and progress I make, the farther I'm going to go? What did you learn, I guess, from any of the doctors you've worked with, let alone at Centeno-Schultz, to help you learn how to realize what really was in your best interest moving forward, as opposed to that frustration of, well, I didn't get 100% relief on that one, it didn't work, and I shouldn't continue?
That's a really good question. Um, I had basically been told there was never going to be a way to improve my situation ever, that I was not going to ever get better. It was always going to be a slow decline. That makes you not trust people. And I can understand the not trusting. And unfortunately, the medical practice that's out there is very untrustworthy at times. I can see why they would have that fear of, well, they're just trying to get more money out of me. I'll tell you, these guys are different. They're not here. They don't want to keep seeing you. They have enough other people, new people to be seen. They want success. They want everything for you to be successful. And that is the first time I've ever felt that. And I think if you are a good judge of people, you actually come and talk to them, you're going to see that yourself. But it is also in the history of it. I have sent loved ones there and they have not been nickeled and dimed. My husband actually had a disc procedure done on his back, one disc procedure, and that's all he needed. That is not all I needed. I needed a lot. And I am living proof that I'm glad I made that choice, because if I had stopped after 1 or 2, I'd still be in pain and I would still be deteriorating. I am at the point that not only am I not in pain, that I am actually strengthening. I have like guns now. I have actual guns.
I think you mean guns again, right? You must have had him
Guns
earlier.
again.
Guns again.
Guns again. I actually have muscles in my back and neck now, as opposed to just being bony and stuff and having lost all of that. I these this is the proof right there that it has been rebuilt, not just given lip service. So I hope that answered your question, but that's how I feel.
I'll just say I'm super proud of you, Pam, for what you've been through, and I can see everybody here. We've got our more viewers for this show at this time at the end than we did in the beginning. Your story is certainly, I guess, pun intended, hitting a nerve. Dr. Centeno, let's have you wrap up today's show with what everybody needs to know.
Yeah, well, thanks so much to Pam for volunteering to do this. Like I said, this kind of started because I saw Pam last week, and I was like, my God, we're not talking about your neck. This is amazing. And then the second thing is realize that, Pam did put more time between procedures. I think Dan Saman brought that up as well, in that, he had done 6 months, 9 months between procedures and had seen a lot of people who, take that 4 to 6 months to really notice an improvement. And because people obviously want to get better quicker and they want out of the nightmare as quickly as possible, we've kind of compressed those treatments into once every 4 months, 5 months. And some people obviously aren't even getting over the original flare from the procedure before they're getting a second one. So that's something that Pam did different. Another thing that Pam did different, like she said, is to really spend time figuring out what she needed to do to heal. And then another thing was, that gyrostim treatment, which was quite unique. I think she's the only PICL patient I've had that's done that. And just for people coming in late, that's a procedure, or not a procedure, a physical therapy regimen where they put you in a chair and the chair moves and you move your hand and or your neck to follow certain targets. And, most PICL patients would look at that thing, like Pam said, and say, I'm never getting in that thing. That's crazy. But ultimately it worked for her because it challenged her neck muscles in ways that she couldn't do any other way. So it's been great to treat Pam, and just realize this was a journey for her, and I wanted everyone to get a chance to speak to her about her journey.
Pam, thank you. Dr. Centeno, very much appreciated. Let's wrap a few things up here. Of course, if you are curious to know if you might be one of the up to 8 million people who have coverage for Regenexx procedures, you want to go to the website regenexcoverage.com. And if any of this is interesting to you or somebody you know and love, have them reach out to the Centeno-Schultz Clinic, set up either a telehealth conference, speak to a doctor from the convenience of anywhere you've got an internet connection, or if you're able to, come on into the Centeno-Schultz Clinic, speak directly to really one of the world's foremost experts in this category, in this specialty. As Pam will tell you, it is life-saving, life-changing, life-enhancing, life-improving in many ways. And, if the question is, can we help you? There's only one answer to that, and that is, let's find out. So make an appointment, get on with the telehealth if you're not local, and if you are local, get in and find out if help is available for you. If you've liked this show, if you've got questions, leave us comments below. If you've had an amazing procedure in the past, leave your comments below too. Something tells me we're going to have more guests in the future, of more people with more success stories. So if you'd like to be one of them, let us know by dropping us a comment down below. And last but not least, if there's been something valuable for you here, please share this program with other people you know who should be watching it. That may be friends or family or doctors you may have seen or known or have connected with in the past. This is your opportunity to work with Dr. Chris Centeno, ask him questions. And he really is the inventor. I call him the Elon Musk of stem cells. You can call him your savior, whichever you'd like to. Bottom line is, reach out, get help, share this with others, find out if you've got coverage. Thank you for watching. On behalf of Pam, on behalf of Dr. Centeno, I'm Dr. Jason Deitch. Enjoy your day. We will not be here this Friday. Stay tuned for updates on our schedule. We will see you here next Monday. Enjoy your week, everyone. Stay well, be kind, and thank you for watching.